When we talk about rice eating, there are now very good studies which have shown that consumption of rice is related to a higher prevalence of diabetes in certain areas. When we talk about food, we should talk about the individual. We should also talk about the likes and the dislikes of an individual. Now, switching over from white rice to brown or red rice because it contains more fiber is actually a good thing. But the acceptance of doing or entitling the patient to make such a change is not easy. So we have to discuss this and see about compliance before we make that major. Diet can always be a very subjective issue. A patient might tell you, or an individual might tell you, I'm taking X amount, but they may be taking X plus 1 plus 2 or more than that. So that is a very important factor which we have no control over. So when you give a dietary counseling to a patient, repetition is mandatory. So that's an important factor. So when they say they take a good amount of ragi and the sugars aren't coming down, are they following the other issues in terms of which they require compliance? Are they doing exercise? And other forms of lifestyle which are also extremely important in type 2 diabetes, improving their sleep pattern, etc. Alcohol. Have they cut down on various other factors? So we need to take a proper history and of course counsel the patients on these aspects when we are dealing with dietary counseling in addition. Long-term studies on protein supplements over many years have not been performed, and we do not know what other additives in this which may cause negative aspects in terms of human health which may occur. We're really not sure. I would much rather tell my client or my patient that you should try to take the appropriate kind of healthy protein-rich diet, which may in fact be much cheaper. And a normal diet contains the other healthy components like vitamins, fiber, etc., which a plain protein supplement does not contain.